were initially created as a tool to help kids and adults with ADHD. But many parents, teachers, and experts believe that they do more distracting than actually helping people concentrate. So is it a tool or is it a toy? Let's discuss this with John Huber, a clinical forensic psychologist. John, thanks for being with us as always. For somebody with autism, is this the kind of thing that could help them?
I don't believe so. It is more like a toy and probably about as effective as a worry stone.
But the idea of having something in your hands that you can constantly play with, we all know children who constantly need some sensation of some kind, right?
We all do know children, but some of it's developmentally normal, and we need to let our kids be kids for a while until it becomes problematic, and then we have to teach them how to, for example, break down activities into parts so they can focus on a little part at a time instead of a whole big activity at one time that may be overwhelming.
Is there any upside that you can see to this fidget toy?
Well, I think if you look at the marketplace, there's some people who've made some money off of these pretty well. And, you know, much like the pet rock, it has definitely stimulated discussion about anxiety and childhood depression and ADHD. So with my mainstream mental health nonprofit, that's one of the things that I want to have happen, is to have that conversation out there in the public.
Once upon a time, there was the conversation about the Rubik's Cube and the Slinky and other toys that kids would play with, and I remember the little red balls. Is this just another one of this sort of phase that we're in now, where this will be the toy that a lot of kids will remember and it'll pass?
I would look at it as a fad right now, kind of like slime was just a few months ago. My 12-year-old daughter has probably 30 pounds of slime in her room right now, so yes.
For parents, though, who are dealing with kids who have some sort of disability or autism, what is I mean, look, we don't want them to go and get a fidget spinner to deal with that, but what is the proper way they should be trying to address or understand the challenges that their children face?
Well, with autism, that usually is very individual. There's a lot of similarities, but it's very specific. But if you have kids with ADHD, attention deficit hyperactivity disorder, or anxiety, one of the things you can do is start teaching them, and usually with a therapist, how to identify their triggers and when they're starting to feel that anxiety, and then how they can use certain things like breathing exercises to help getting control of that. Because part of that self-awareness is very key in controlling that, regardless of what techniques you use.
And is that a very difficult technique, or is that a very difficult thing to learn?
It can be, and a lot of it definitely is individual with each child, and sometimes the home makeup, very busy families, it may be very difficult to set down quiet time to allow that child to practice. But it's possible, and you know, things like cognitive behavioral interventions are the most rewarding and successful in those types of situations.
All right, John Huber. John, we will put you down in the category of those who are not that impressed, at least from a psychological point of view, treatment point of view, for fidget spinners. But John, thanks for coming on. We appreciate it.
Thank you very much.
You got it. Now, we want to look